Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
When arteries to your heart become blocked, the outcome could be a heart attack. But there's a condition called PAD that can have the same impact on other parts of your body.
And Pat Walker is live at St. Vincent Health with more. We're taking care of your heart this morning, Pat.
Hey, good morning, Greg. Good morning, Deidre. Yeah, we are talking about PAD. PAD is what we're talking about this morning. And joining me here, I have Dr. Aravind Rao. And we're talking about PAD, which is a peripheral disease, not necessarily at the heart, but a lot of the same things associated with, like, heart disease.
Exactly. Peripheral arterial disease is clogging up of the arteries that supply blood to different parts of the body. It's very similar to the heart disease, where you have fat buildup in the arteries and then decreases blood flow to the arteries, causing symptoms.
So just like the arteries around your heart are supplying blood back to the heart for it to live, you also have the arteries supplying blood to the other parts of your body, to the tissues that need to live too, and they're clogging up just the same.
Exactly. And very similar to the heart disease, where you have the blood supply stop to the heart and you have a heart attack, you can have symptoms in the leg or in the neck. You can have a stroke. You can lose leg because there's no blood supply.
So what are some symptoms people may feel before this really gets too far gone?
Right. It all depends on where the fat starts building up. If it's in the leg, people tend to have pain when they walk. Sometimes they have non-healing ulcers. If it tends to happen in the neck, then there's a chance of stroke. If it tends to happen in the belly, there's a chance of abdominal pain.
So even like say it was someplace like in the belly, in the gut, someone just sitting home may confuse it with something else, right?
Yes, but there are certain signs and symptoms that we can diagnose, and we have various tests that we can diagnose exactly and see where the blockage is.
Now you mentioned like with the PAD in your legs, you had the pain when you're walking. Could someone also have that pain while sitting?
Usually, the most common feature of this pain is when they walk. But as the disease progresses, they may even have pain when they just are sitting.
Okay, so someone starts having some of these symptoms. What do you think they should do? What would the first thing to do? Just go to their primary physician first?
Yes, the primary physician, contact your primary physician. And there's a very simple test to screen this. We put blood pressure cuffs on the arms and then legs, and we just check the blood pressure difference. And that's a very good screening tool and gives an idea of whether the patient has disease or not.
So once you've diagnosed it, what do you really start doing for treatment? Is it just medication or are there other things?
It all depends on how bad the blockage is and how bad the symptoms are. If the symptoms are not bad, then it is very important to continue medications, to make sure the clogging up doesn't get worse, it doesn't break loose. So we use some blood thinners, make sure there's good, adequate blood flow.
Are they some of the same medications that would use for necessarily heart disease too?
Very similar. Like we use statins, we use blood pressure medications to lower the blood pressure, and we also use aspirin.
So some of the same things, while they not necessarily at the heart, can also have some of the same effects, like leading to stroke too.
Yes.
Right. So if you have any of these symptoms, as Dr. Rouse has kind of outlined there for us, make sure you do see your local physician, and then he can also get you on to a specialist. Because we also here, since it's February, we want you to have a happy and healthy heart. Deidre and Greg.